Dr. Glazer has this wonderful biomechanics lab and has really analyzed the function of the foot more thoroughly than anyone that's come before him, in my opinion. And it's for this reason that the orthotic, I feel, works better than the root orthotics.
Every time that I made a sole support, you could see the difference. You understood how it was built. You could understand why it was different for the patient. And the results that I got with it were far superior than what I got with the standard Russian orthotic that I was making when I was taught to make in school.
I knew something was wrong, but I really didn't know what was wrong. When Dr. Glazer started talking about this whole new way of casting and how the biomechanics work, my eyes just started opening up because I knew that was the answer.
This is a totally different casting technique. This is the newest technology for casting for an orthotic that is going to make contact with your foot from the heel to the ball of the foot.
The foot is the key to the alignment of their entire body. That if the foot's in line, then the ankle's in line, the knee, the hip, the back, and that it's like a building. If the base of the building is unstable, then the entire structure is unstable.
I can pretty much watch anybody walk and I know how to tweak their body to make their body work right. With these orthotics, you don't have to do that. They just make their body work right.
I went to the Western, and Dr. Glazer was giving his course at the Western, and I just sat there in the audience and said, this makes amazing sense. I hadn't heard this before, this type of thinking and theory. And he offered to make some devices for the audience after the lecture. And so I had them cast me, and 3 weeks later, I got my sole support orthotics in the mail. I put them in my shoe, and literally, from the moment I put them on, my plantar fasciitis was gone.
And I had a lady come in and ask me how my neuroma was. And I thought about it, and I realized that my neuroma had been gone for about 3 months.
That's
after I started wearing these sole supports.
If you do surgery, you may not like this because I've cut my surgery down considerably.
A lot of my patients did not need surgery anymore. So my surgical volume has literally decreased quite a bit, actually. Initially, I was calculating about 20–30% went down. A lot of the heel pain patients did not have to go to surgery. A lot of other, problems just kind of went away.
I started recognizing that this thing was getting rid of neuromas. So I started picking all my patients that had neuromas and putting them in sole supports, and it takes 2 to 3 months, and I haven't missed with one patient in over 3 years with neuromas.
Yes, I'm doing less surgery. I'm doing less neuroma surgery, definitely less neuroma surgery.
After the neuroma stuff, then I said, well, maybe I'll try this, and I picked another problem, and I started just using those, and eventually I just wouldn't go back.
It changes how your patient outcomes are successful, maybe from a 30–40% success rate with fasciitis all the way up to a 95% success rate.
My plantar fasciitis procedures are conservative to a vast degree now. My neuroma resections are diminished greatly at this point.
I do plantar fascial releases, EPFs, and I do some, but I don't have to do a large volume of them. Usually I can correct the problem with the sole supports.
I mean, if you think about it, people don't want to go to the operating room. They don't want to go to the operating room. They would much rather, and especially now, maybe the economy isn't doing so well, so the last thing they want to do is end up in the operating room, but they can't work. So this is a perfect opportunity to offer a patient an opportunity to get better conservatively without surgery.
I mean, I don't want to have surgery. I said, well, I agree with you, and this is what we can do. This is what the sole support system will do, and this is what we can do to get your feet balanced. So if we keep it balanced, we'll mitigate further damage to the joints in your foot, further damage of creating bunions, further hammer toes, further heel pain.
Posterior tib tendonitis and all kinds of other soft tissue problems can be resolved once we pay attention to the ground and start bringing the ground to the patient's foot with proper calibration.
And even if they have the EPF, they still need the sole support because we want to avoid the joint problems that occur after a plantar fascial release. And the sole support's very good at stabilizing the foot and not getting those secondary problems.
It's amazing how many of these problems go away, and it really opens your eyes to what we can do as clinicians just by changing the ground instead of the foot.
People ask me what I use, and I tell them that I use sole supports, and I just tell them that they work.
Yes, we do bill for them.
Their insurance will cover it when it's custom made.
The typical code for orthotics.
That's the L3000 code.
Code L3000.
We use L3000 code.
That said, I mean, there are times when orthotics are not covered and patients pay out of pocket.
We see them 3 or 4 weeks after the first dispensing of the orthotic, and then we schedule them for a month later, and then after that we try to schedule them the next month, but there's not much happening because they're usually so much better. They tell you, "Doc, I'm doing great, I don't need to come back," and that's the best patient testimonial you can get.